and then you can think about Cyananthus. Thirdly, the causative substance. 4 different remedies are required for the same pathology may be needed. Fifth, the same case may need alteration of the remedies. Lastly, please prescribe for the present state. My God, it's so important. Please prescribe for the present state. Then different blocks. What are the different blocks in the treatment?
Sorry to interrupt, sir.
हाँ, बोलो बोलो.
सर सर आपने अभी ऑस्टियोआर्थराइटिस के लिए अपने एक रेमेडी का नाम लिया बीच में. विल यू प्लीज रिपीट?
This the remedy is OAN, osteoarthritis nosode. OAN. It is the most miracle drug in our practice. You can ask my student how I am using.
Sir, but then how will be the repetition and potencies?
See, this drug should be given 1 dose. That is enough. Need not to repeat also. They will be much okay. शायद महीने में एक बार यूज करना पड़े. 200.
Sir, any specific indications for ON?
Very good. First specific indication is 3rd stage of osteoarthritis. It works from 2nd to 3rd stage of osteoarthritis. Second important point of ONA is burning sensation. Many cases of osteoarthritis with burning, बड़े छे. In Gujarati they will tell you बड़े छे. घुटन मारा बड़े छे. जलता है घुटन मेरा. This is very peculiar of osteoarthritis. Third indication is when the curvature of the bone has become bow-legged. Dhanush jaisa, dhanush, bow-legged. Osteoarthritis. Severe changes in the bone, that is bow-legged. Fourth indication. नावड़ी देखा है आपने? बोट नावड़ी, नर्मदा नावड़ी में ऐसे ऐसे चलेंगे ना, कई लोग ऐसे ऐसे चलते हैं, टक टक टक. This is the 4th indication of osteoarthritis nosode in 200 potency. नावड़ी विहार. नावड़ी मतलब बोर्ड में अगर आप जा रहे हो तो बोर्ड जब हिलती है ना तो पेशेंट भी ऐसे हिल हिल के चलता है. There are many, but these are the 4 major indication on which I give OAN nosode in 200 potency. OAN 200 potency. अभी भी बहुत सारे बता सकता हूँ, but time constraint still. First, by our constitution. Second, by pathological specific remedies. Third, by acute remedies. Fourth, by anti-miasmatic remedies like Moxol in syphilitic, nitric acid in psychotic cases, even Thuja. In psoric cases, we need sorinum and sulfur. Fifthly, by our sarcodes like thyroidinum, uforinum. Sixth, by our known nosodes, medorinum. Sabka baap is medorinum. Yes, medorinum bina, what Dr. Burnett has said, without medorinum, you can't cure sciatica. My God. Sciatica का केस सॉल्व ही नहीं सकता है. Not solved. मेरे स्टेटस पे एक केस रखा हुआ है अभी मैंने देखा आपने वो. मैं इसको थोड़ा रन करना चाहूँ. सी कैसे मैं रन करूँ उसको. मोबाइल में क्या देखा से बहुत मस्त केस है. चलो कभी और टाइम पे बताऊंगा. लाइव केस रिसेंटली सॉल्व विद वन ऑफ द रेमेडीज. अब ताज्जुब हो जाओगे. स्टेटस इसमें कैसे देख सकते हैं? स्टेटस कैसे बता सकते हैं? जो ना जरा अच्छा એવું છે. વાહ, નહીં તો કૌશલ પ્રતિકમાં નાખી એવું બતાવજો કેસ. આ કેસ છે. આનું બંધ કરી નીચે. स्क्रीन शेयरिंग बंद करो. स्टॉप शेयरिंग. स्टॉप शेयर. हाँ, स्टॉप शेयर बंद कर दो. We are not technically sound. So just now we saw a case, severe sciatica problem, and that was a hell of a problem for me. And he improved with one of the remedy, which I'll tell you the next time. It is a secret remedy. The rubric of mine is secretive. Superbly solved. Single-handed. Even khasi, matlab coughing was also solved completely with this remedy. So we have to read many cases, and we have to read all our stalwarts like Barnett, Bonninghausen, Hahnemann. So you take this screenshot. First is constitution, second is pathological specific, acute remedy, anti-miasmatic, Charcot's, nosode, and vaccine state. For example, COVID-19 vaccine we have, influenza we have injuries, we have snake bites, we have insect bites, any disease like diphtheria, electric shock. Do you know Hahnemann has given one remedy like electricitas? It is there in Allen's nosode. Electricitas. Please likho electricitas. A remedy given by Dr. Hahnemann in soramycin. Sorry, it is electricitas. Hahnemann has used like anything. This is unknown drug for our understanding, but it was used profoundly by Dr. Hahnemann. And it is given in Allen's nosode. For? Yes, you can think. क्या? अच्छा 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 ऐसा सस्पेंस एग्रेवेशन ऐसे बहुत सारे हैं. Suspense should be maintained, no? Then only you will learn. What is the procedure of learning? Suspense. There is rubric in Fatak, suspense aggravation. Open Fatak and see what is the rubric.
Argentum nitricum.
Very good. Congratulations. Who is that person? Naam bolo.
Dr. Bharat.
Yes, Bharat. Good, Bharat. Clinical understanding in the process of cure. First and foremost, pathology has to be considered first in the process of analysis and evaluation of the case. Multiple remedies are required in most complicated case. Third, anti-miasmatic remedies are required to break the miasmatic block in the case. My God. for all the different states has to be addressed by different acute or smaller pathological remedies are to be taken into consideration. Fifth, different sarcodes are required in the process of cure. Different complaint, estrogen, progesterone, testosterone. Testosterone can be used in hirsutism. आजकल बाल उग जाते हैं ना, hirsutism, testosterone. Anterior pituitary can be used in to increase the height. Anterior pituitary, growth hormone. Anterior pituitary is सबका बाप is anterior pituitary. Anterior pituitary, if you see, it is anterior as well as pituitary, two parts of pituitary. Anterior pituitary indication दूसरा लिखना है, ये तो पूरा सार्कोट सेमिनार हो जाएगा. Anterior pituitary is used for metal allergy. Anterior pituitary is used for ulceration of pinna. बुट्टी जो पहनते हैं ना, बुट्टी, कान की बुट्टी. Anterior pituitary 30 potency if you give, totally cure हो जाता है. Third indication of anterior pituitary is vitiligo, white spot. Please give intercurrent remedy anterior pituitary to solve the cases.
Sir, potency?
Potency 30 or 200 depending on the susceptibility of the case. Anterior pituitary can be used in amenorrhea cases when you see there is lot of mental depression. Then now we'll start with case number 4. So case 4, a case of a woman complaining about lump in the throat with regurgitation of food. So it was a case of a woman where she had a lump sensation in the throat. Something which is obstructed. In Gujarati it is said, kasuk atke che. Something is there in my throat. And there was a regurgitation of food since 3 to 4 months. And she was much exaggerating her symptom. अरे मुझे ये हो रहा है, मुझे वो ये हो रहा है, ये हो रहा है. This is exaggeration of the symptom. As if she would be having esophageal carcinoma. अरे मेरे को कैंसर हो जाएगा. And also she has insomnia and cardiac asthma. Worse, lying on left side. And lot of nervous palpitation. Dhabkara, that is palpitation. At night, worse on active exertion. She had in the past malaria and asthma when she was 10 years of age. What was the family history? Family history of father had habit of drinking alcohol and also had paralysis. And mother had bone pain at night diagnosed as osteomyelitis. So this is the family history. In her personal history, she was thirsty, towards chilly, and had done hysterectomy after heavy periods and oily sticky urination. Ye underline kar lo, very important. The medicine was given on the basis of long case taking. The remedy is asafoetida. Itna simple hai na? Globus, exaggeration of symptom and checked menses. She improved with asafoetida, which was given in 200 potency BD for 7 days, followed after 30 days. So asafoetida was given, but she didn't improve so much. But insomnia and her cardiac symptom, cardiac asthma with nervous palpitation remained since then. She visited MD physician who advised her to do lipid profile, and X-ray chest was there, and she was diagnosed with sclerosed artery and hyperlipidemia. अंडरलाइन करो. She had developed problem of writing and lot of mistaking adding money when giving money to her servant and धोबी वाला. धोबी वाला ना कितना होता है ये गिनने में. there she has difficulty in counting, calculation difficulty. What is the remedy? Who will tell me the remedy? ऐसा 40 was given.
Critagus, Critagus, Critagus.
Crataegus. Okay, good. Any other remedy? Good. Anything else? This is very characteristic of this remedy. Develop problem of writing and lot of mistaking adding money when giving money to her servant and Dhobiwa. This is the tissue remedy for sclerosed artery. What is the remedy?
Calcarea floor.
Calculated
Tissue
floor.
remedy for sclerosed artery given in boric. Boric.
Syphilinum.
Tissue. नहीं बच्चा. Sclerosed artery. Tissue remedy for sclerosed artery.
So calculated floor.
Sclerosed artery. Boric देखो ना. Sclerosed arteries. Boric, see
Vanadium.
boric.
Mucus.
No. Sam, no, which? Sclerosed artery. Last line given. Read. Read boric. Open boric. ऐसा 40 was given and she had this symptom. Insomnia and cardiac asthma. ऐसा 40 था तो solve कर दे.
Aurum?
Sorry. Ferrum, no.
Aurum.
Sumbul. Very good. Sumbulus mostatus. What is mostatus? What is moscus? Deer, no? Primitive deer. So what is the common name? Sumbulus mostatus, Ferula sumbul. This has this peculiar symptom. Please read this remedy. This is tissue remedy for sclerosed artery. Sumbulus mostatus. And every 3 hours for arteriosclerosis. Where it is written? Boric. See? In doses. मैं पूरा लिख देता हूँ फिर बोरिक भी पढ़ते हैं. A tissue remedy for sclerosed arteries. Difficulty in adding and mistake in writing. देखा? अरे बाबा हाँ तो बोलो. Nervous palpitation. Oily urination. Very important. Hysterical and emotional. Hysterical emotion like asafoetida. Past history of malaria myxum. This is umbellifery. Insomnia. cardiac asthma.
דינה, בוקר טוב. תני לו מנה אחת של פסורינום 1M עכשיו,
Worse
ובעוד 4
active
שעות
exercise.
שייקח ארסני.
Worse lying left side. This is very important of Sumbulus. Sumbul. So we'll read Boric Materia Medica. Has many nervous, hysterical and nervous symptoms. दिखाई दे रहा है उसमें. Has many hysterical and nervous symptoms and use in neuralgic affection, anomalous functional cardiac disorder. Numbness on becoming cold. A very important symptom. Numbness on becoming cold. Numbness on left side. Insomnia of delirium tremors. 15 drops of tinctures. Insomnia of delirium tremors. Sensation as if water dropped down spine. आपने वाचे तो पहले first. A tissue remedy for sclerosed artery. પછી જો શું લખે છે? Emotional and fidgetity, dull in morning, clear in evening, Mistake in writing and adding. बहुत important है यार. Don't forget this symptom. Comedon, tenacious yellow mucus in nose. Choking, जो देखो. Choking, constriction, constant swelling, belching of gas from stomach. जहाँ एसोफिटाइटिस लगता है अपने को. Umbellifery. Spasm of pharyngeal muscles. Tenacious mucus in throat. उस टाइम पे अपने को एसोफिटाइटिस ही लगेगा. अगर ये मेंटल सिम्टम नहीं आएगा. Nervous palpitation, neuralgia around left breast and left hypochondriacal region. Cardiac asthma आया ना, cardiac asthma. Aching left arm. Heavy numb very, lose breath on exertion like Calcary asks. Pulse which is irregular. Female ovarian neuralgia. Abdominal full, distended and painful. Climacteric flushes like hypertelia and zebraendi. Oily pellicles on surface of urine. See oily. Worse active exercise left side. Worse left side. अपने को उस टाइम पे लेकेसिस भी दिखता है. Compare asafoetide and Moschus. See what Boric gives. Moschus. Dr. W. McGeorge advised 2x every 3 hourly for atherosclerosis. So it is a sclerosed artery. Tissue remedies for sclerosis. First remedy that we saw was Ruta. Second was China horse. Third is Sumbul and asafoetide. So different remedies required for a different conditions. Now case 5. A case of housemaid working at different house came with complaint of menometeorrhea. मतलब ये काम वाली का है जो घर में काम करती है और different हाउस में जाती है और उसको कंप्लेन मेनोमेटोरेजिया का था. उसका कंप्लेन क्या था? She feels better after menses. मासिक आवी जाए. If menses comes, I feel better. She had gum bleeding, worse sucking them. हम अंदर bleeding starts. She has peculiar eczema of the back at the coccyx that each till it bleeds. This is peculiarity of this remedy given in Anam Chaudhary. On observation, she had face puffiness. क्या observation था? Face puffiness. She feels better in company and does not like to attend social functions. Does like to attend social functions. Does not like is palladium. Reverse is palladium. Reverse is palladium. She said utensils break from my hand. She speaks truth to everyone. मतलब साचू बोली जाऊँ छो. I speak truth to everyone. She is open-hearted. What is the remedy?
Bovista.
Bovista. Congratulations. Bovista. So easy, no? So the remedy is Bovista. So this is the repertorization. अभी दिख रहा है? Patak eruption, cosmetic aggravation, feet swelling, edema, sprain after, coccyx itching, bleeding, ambulation, children, infants, stammering, menses intermittent, edema, joints or fracture after. These are the common which I have taken, Bovista cases. What are the dreams that you see in Bovista? Who will tell me
Snakes,
dream of?
snakes, sir, snakes.
Yes, sir. Bitten by, very important. Bitten by. Bitten by a snake is very important in Bovista cases. Now you can see open-hearted. जार में देखना, जार one of the very old homeopathy is जार. जार बताता हूं मैं आपको. जार Charge repertory. Excessively open-hearted. See? Please see this remedy, please. See? What is the remedy given here? What is the remedy given? अरे पापा बोलो ना.
Borax.
What is it? Borax. Borax. See, borax. Borax patients are excessively open-hearted. They are from natrum. Natrum line. The column. Column 1. Column 1. And periodic table में क्या आता है उसमें? Row कौन सा आता है? What is row, Nitin, of natrum?
Third row.
Row 3.
Row 3. Very good. नितिन का भी एक स्पेसिफिक रेमेडी है. ओके, ये जार ने बहुत इंटरेस्टिंगली दिया हुआ. These old authors, if you understand them, no, you will reach to the remedy so easy. और जार जैसा तो कभी हम पढ़ेंगे ही नहीं, है ना? Which is the selfish remedy of matrimony? Which is the most you want to see which is selfish remedy?
Yes, sir.
So,
I'll show you the selfish remedy. You have to open Boger. Open Boger if you have. And type selfish. What is the remedy seen?
Senecio aureus.
Senecio aureus. And it belongs to which family? Senecio. No, bacha. No.
Compositea, compositea.
Compositia. Very nice. Very nice. Compositia. Very nice. Superb. Rene, no? You are Rene, I think.
Ronen, yes.
Ronen, okay. Congratulations, Ronen.
Thank you.
Very nice. Thank you. Thank you so much. So remember jar which has written open-hearted, excessively open-hearted. Now we'll start with clinical essence of Bovista. What is the clinical essence of Bovista? Society or social function emulates the Bovista cases. So in Bovista, society or social function emulates. You know, my wife always attends all kind of social functions and she is Bovista. Awkwardness in walking and things falls from hand. Effects of overexertion and laxity of joints. This is very important of Bovista cases. Stammering in children. Senecio aureus will be selfish in terms of sharing things like pulsatilla. But it should have the essence of composite, that is injury. When the senecio is injured, they will never share their things with anyone. Pulsatilla will never share when she sees profit from that person, then only she will share. That is the biggest difference of senecio with pulsatilla selfishness. Senecio peoples are selfish. They will not share anything because of their hurt feeling. If you see the sensation level, if you go to the sensation level of Rajan Sankaran, this is the thing. There is another remedy called Helonius, where Helonius is which family? Who will tell me?
Liliaceae.
Helonius is, yes, from which?
Liliaceae.
Melanthus.
There are
Yes,
two
right.
families.
Yes, right. Now, what is the main symptom of Hellenius given in Kant's repertory? Who will tell me? Kant's repertory. Kant's repertory Hellenius. Kant repertory. Kant. Hellenius Kant repertory. Raise Renan. Suggestion will not receive. Suggestion will not receive. Hellenius is only the remedy in Kant's repertory. Suggestion will not receive. I like to show this in suggestion will not receive. Hellenius. The only remedy in Kant's repertory. Hellenius. Please remember this remedy because of its contradiction intolerance of given in Fatak's Matra Medica. If you open Fatak, Hellenius. Please open Fatak, Hellenius. Fatak. Mind extremely gloomy, melancholy, irritable, cannot bear least contradiction. Find faults with everyone. Desire to be let alone. Conversation unpleasant. Always better when doing something. When the mind is engaged, like sapia, no? Occupation emulation. Hellenius. We are changing the track frequently. So we'll jump to that. Edema after sprains. Sensation of enlargement, feeling of hugeness in ovaries and uterus. Discharge of orifices are tough and tenacious. Skin unhealthy, itching at tip of coccyx. It is given very well in N.M. Chaudhary. So we'll see N.M. Chaudhary. So we'll open N.M. Chaudhary. Bovista. N.M. Chaudhary. N.M. Chaudhary. Please open N.M. Chaudhary. Are you able to see that? Please देखोगे नहीं तो पता नहीं चलेगा. See, skin is without doubt very unhealthy. It is leathery, chamda jeevi, leathery. The eruption may be either dry or moist. Warts and cones are to be found everywhere. My God, warts and cones are to be found everywhere. Urticaria covers nearly the whole body. My God. ठंडे ठंडे पानी से नहाना चाहिए. गाना आए या ना आए. Which is the remedy? ठंडे ठंडे पानी से नहाना चाहिए. Mephitis. ठंडे ठंडे पानी से नहाना चाहिए. This is Mephitis. In this, there is one particular locality, a site, special site in Bovista, where you find intense eating, and that part is tip of coccygeus. It scratches till it bleeds. Even then, there is no relief. The locality, the affinity for local things, what the Boger says, the affinity, part affinity. And feeling of enlargement. See what is third and important characteristic in enlargement. Why enlargement? Bovista is fungus, no? Puff ball. Ovaries feels too large. Chocolate. What is chocolate? Chocolate cyst. This is one of the drug for chocolate cyst. आजकल बहुत common है chocolate cyst. It is puff. A sensation of discourage sure calls for Bovista, and numerous cases have been affected of these symptoms. ये पढ़ो बहुत important है. It is prepared from watered puff balls of fungus eaten in Italy and handy remedy in treatment of old maids who are naturally nervous and awkward. One must not be led to feel that we have stereotypes remedy for certain class of people. All we mean is that Bovista corresponds to a certain types whom circumstances of life have been intensely awkward and is ill at ease. This awkwardness is manifest by constant tendency to drop things like apis, natramure, Bovista. They drop cups, saucers, and various other objects and break them constantly in spite of great carefulness and firm determination not to do so. This partly due to weariness and weakness of joint and partly of intense nervousness. My God, क्या लिखता है? Another peculiarity of the patient is that they are somewhat bloated. आजकल कई ladies will tell you, फूलेलू शरीर लागे छे. I feel bloated. They are much more puffy and integuments. Often about them is somewhat velvety. The result is that they can not handle anything tight without having been distinctly marked left about them. Marked left about them. Contact dermatitis. Contact and impression. Contact and impression. This is very important. So the next clinical essence of Bovista. Menorrhagia at night time, Maccarb and Netmure, diarrhea before menses, ammonium car, ammonium, veratrum and sometimes Cilicia also. Cilicia is gastritis. Leukorrhea is prominent. Eruption cosmetic, worse menses, hot bleeding, bending double, eating hot food. So this is the Bovista, puff ball. Now case 6. Very simple case. Case of an old man with BPH having complaints of involuntary urination, has to wait for urination to start and straining at stool with lots of constipation during cloudy weather. Mentally gets worse during. This is important. Mentally gets worse during. Mental symptoms. He used to live sedentary lives, quarrelsome, gets angry on himself, does not like to meet people, aloof. Aloof is leprosymism. Abusive and insulting, very much discontented with himself, but very friendly with outside people. And always had anxiety about his success and hatredness for people who do not agree with them, like calcareous self, and does not like music. What is the remedy?